A march into the unknown to tell the story of a city's battle against a novel and deadly virus. In early January, CGTN sent reporters to Wuhan, the epicenter of China's COVID-19 outbreak. As the situation worsened, they were joined by dozens more staff. Despite the lockdown, our reporters went to nearly every district of the city, including some with high rates of transmission.
We are now heading to the Xiehe Hospital.
The team filmed scores of people for its series Wuhan Faces, patients and medical staff, community workers, volunteers and psychological counselors, focusing on lives being affected.
Facts to our general public, to the international audience.
CGTN became a window into the city at the heart of China's coronavirus outbreak, weeks before it became a global pandemic.
What's happening there on the ground?
Wuhan.
More than 24 overseas media organizations, including BBC, Fox, RT, and TRT, spoke live to CGTN reporters for the latest news and views on the spread of the disease and on prevention and control efforts. A month after the lockdown of Wuhan, CGTN reporters ran a 30-minute documentary demonstrating the tireless efforts of frontline workers and the extraordinary measures being taken by authorities to keep residents safe. It was the first long documentary. While hundreds of patients were sent to intensive care units for emergency treatment, CGTN ran another documentary on what it was like inside these highly stressful zones, and a half-year review of China's fight against COVID-19 will be aired this week.
What would be your
As the pandemic situation eased in China, frontline doctors shared their first-hand experiences with the world.
Personal protective?
Wear goggles and also protective screens.
As many experienced Chinese medical staff went abroad to help countries in need, CGTN reporters were also there.
This is the newest and largest hospital in Sudan. It started.
We honor the sacrifices and share the happiness and tears. And the story continues.